Welcome to the deep dive. Today we're tackling something really fundamental to how our bodies heal oxygen. And we're going beyond just breathing it. We're diving into hyperbaric oxygen therapy, HbO2, especially for those really stubborn wounds that just won't mend.
Exactly. And, most people hear HbO2 and think, okay, more oxygen, which is, well, true, but it's only part of the story.
Right.
What's really fascinating, and what we'll explore, is how that extra oxygen delivered under pressure sets off this whole cascade of beneficial changes deep within the body. It's much more intricate than it seems.
So we're going way beyond the basics today. And to really get to grips with this, we've been looking at some detailed sources, including chapters from hyperbaric medicine practice, really focusing on why oxygen is so critical and the various ways HbO2 actually works.
Yeah, our mission today is pretty straightforward, really. We want to give you a clear, insightful picture of how HbO2 promotes healing and tackles some related health problems. Think of it as understanding the how and why behind this therapy.
Okay, let's start with the basics then. Wounds need oxygen. We all kind of know that. But how much? Like, what's the actual level needed for healing to happen?
That's a great question. The foundational work was really done by T.K. Hunt and his colleagues. They showed that the fluid around the wound cells needs an oxygen tension that's the level of about 30 to 40 millimeters of mercury.
30 to 40, okay.
Yeah, and critically, if it drops below 30 mmHg, healing is really, really unlikely to occur properly. It's like trying to build something without enough raw materials. It just stalls.
That really puts a number on it.
Yeah.
So when you're faced with these problem wounds, these ones that are stalled, what are the main strategies doctors use?
Well, generally, there are about 5 key approaches. You've got things like surgically cleaning the wound, debridement, protecting it, managing the patient's overall health, using the right dressing.
Standard stuff, yeah.
Right. But the 5th strategy, and the one relevant to our chat today, is actively augmenting or increasing the oxygen supply to the wound.
Because it's not just a little bit extra oxygen needed during an injury, is it? I've heard the demand can really shoot up.
Oh, absolutely. When your body's repairing tissue or fighting infection, the local oxygen requirement can jump dramatically. We're talking 20 times the normal amount, sometimes even more.
20 times.
Luckily, our vascular system, our blood vessels, have a decent reserve capacity to try and meet that surge.
Wow. And you mentioned infection fighting has its own big oxygen demand.
It does, and this is really quite striking. When immune cells, like neutrophils, attack bacteria, they use what's called an oxygen burst. It's this intense metabolic activity.
Right.
And during that burst, right at that spot, the oxygen consumption can spike by over 100-fold.
100 times.
Yeah. It really highlights just how critical getting enough oxygen is when you're dealing with an infected wound.
So if our bodies have this reserve capacity,
Yeah.
why do we get these problem wounds, though? What stops the oxygen getting there?
Well, the sources point to about 8 main reasons why oxygen delivery might be impaired. And the most common one, it's atherosclerosis.
Ah, the plaque buildup.
Exactly. Hardening and narrowing of the arteries. It's like, stepping on the garden hose. Less flow gets through.
Makes perfect sense. So clogged pipes are number one. What else gets in the way?
You also see issues from, say, direct injury damaging vessels, problems with veins not draining blood away properly, like venous stasis. External pressure can squash vessels.
Right.
Then there are conditions like vasculitis, where vessels get inflamed, blood clots, obviously, low blood pressure, spasms in the vessel walls, and even some medications can interfere. It's quite a list.
Yeah, it sounds complex. And HbO2 isn't the only tool in the box for improving flow, is it? What else can be done?
That's a really important point. HbO2 is one approach, but definitely not the only one. You have surgical options, revascularization, basically. Procedures to bypass or open up blocked arteries.
Like bypass surgery or stents.
Precisely. Also, strategies to reduce swelling because edema can compress vessels.
Yeah.
Medications to boost heart function or improve circulation. And even things called rheological interventions drugs that basically make blood flow a bit more easily, less viscous.
Okay, so we've established oxygen is critical and lots of things can block it. Let's get to the main event now, hyperbaric oxygen therapy itself. Remind us in simple terms what actually happens during a treatment.
Okay, so HbO2, in essence, involves the patient breathing 100% pure oxygen while they're inside a specially designed chamber.
Right.
And this chamber is pressurized usually to between 2 and 3 times the normal atmospheric pressure we experience at sea level. We call that 2 to 3 atmospheres absolute, or ATA.
2 to 3 times normal pressure, breathing pure oxygen. What are the immediate, the sort of first things that happen in the body because of that?
The primary mechanisms, the ones that kick in right away, are really twofold. Hyperoxygenation, which is just massively increasing the oxygen in the blood and the direct physical effects of the increased pressure itself.
Okay, let's unpack hyperoxygenation first. How does breathing pure O2 under pressure get so much more oxygen into our tissues? It sounds simple, but how does it work?
It comes down to physics, specifically a principle called Henry's law.
Ah, Henry's law. Okay.
Yeah. It basically states that the amount of gas that dissolves in a liquid is directly proportional to the pressure of that gas above the liquid. So you increase the pressure of oxygen and breathe pure oxygen.
And more dissolves in your blood plasma.
Exactly, dramatically more. The liquid part of your blood, the plasma, gets saturated. Our sources suggest you can get about a tenfold increase in the oxygen carried just dissolved in the plasma.
Tenfold. That's huge. And that extra dissolved oxygen then gets out to the tissues.
Precisely. This superoxygenated plasma flows through the capillaries, increasing oxygen levels in the fluid around the cells. And crucially, it increases the distance oxygen can effectively diffuse or travel from those tiny blood vessels out into the surrounding tissues.
So it's like giving oxygen longer legs, essentially, allowing it to reach further.
That's a good way to put it, yeah.
How does that compare to how oxygen normally travels, attached to hemoglobin in red blood cells?
That's the key difference. Normally, almost all oxygen, like 97.5%, is bound to hemoglobin inside red blood cells.
Right.
And under normal conditions, breathing air at sea level, your hemoglobin is already almost fully saturated, maybe 95, 98%. Breathing more air doesn't really add much more capacity there.
But the plasma oxygen is different under pressure.
Totally different. The amount dissolved in plasma just keeps going up as you increase the oxygen pressure. And this is where HbO2 really shines. It means the plasma can carry enough oxygen to potentially compensate, even if the red blood cells aren't working properly or aren't there in sufficient numbers.
That makes me think of that famous life without blood experiment. What was the takeaway there?
Borema's study. Quite remarkable. Back in the 60s, I think. They took piglets, carefully removed almost all their red blood cells, replacing the volume with plasma expander.
Wow.
And kept them alive purely using HbO2. The oxygen physically dissolved in the plasma, thanks to the hyperbaric pressure, was enough to meet the animal's tissue needs for a short time.
That's incredible.
It really proved, definitively, that our tissues can use oxygen directly dissolved in plasma. Before that, the thinking was it all had to come via hemoglobin. It showed this amazing backup system we have.
Mind-blowing. So this hyperoxygenation effect has some really significant clinical uses then.
Absolutely. The sources point to 4 main areas. 1, improving oxygen supply where blood flow is poor. Think peripheral artery disease or compartment syndrome where pressure builds up.
Okay.
2, helping oxygen cross barriers like swelling, scar tissue, or maybe thickened capillary walls you see in diabetes. 3, flushing out harmful gases. The classic example is carbon monoxide poisoning.
Right, CO binds to hemoglobin.
Exactly, it displaces oxygen. But the high dissolved oxygen from HbO2 can still supply the tissues and helps push the CO off. And 4th, as Borema showed, compensating when oxygen carrying capacity is low, like in severe anemia or potentially during a sickle cell crisis.
Okay, you also mentioned the mass effect of hyperoxygenation. What's that referring to?
Think of it like creating a really steep concentration gradient. With so much more oxygen dissolved in the plasma under HbO2, there's a much stronger push for that oxygen to move out of the capillaries and into the tissues.
Like pressure forcing it out.
Sort of a diffusion pressure, yeah. It overcomes resistance and increases the effective distance oxygen can travel from the blood vessel. Research by Crow way back and later calculations by Pierce confirmed this a significantly extended diffusion radius under hyperbaric conditions.
So even if blood flow in the tiniest vessels, the capillaries, is a bit sluggish or blocked, HbO2 can still deliver the goods.
That's a key benefit. In the microcirculation, where maybe red cells are struggling to squeeze through, the oxygen dissolved in the plasma isn't so dependent on that cell flow. It can diffuse across and sort of bridge the gap, keeping tissues alive.
The bridging therapy idea.
Exactly. It buys time, keeps tissue viable until the underlying flow problem can maybe be fixed surgically or medically.
Okay, that makes sense. And these hyperoxygenation effects, they're powerful, but relatively short-lived after the treatment ends.
That's right. The boost in tissue oxygen is rapid during the treatment, and levels stay elevated for maybe a few hours afterwards, but it is temporary. However, these repeated short bursts seem sufficient to trigger important downstream biological effects. It's also dose-dependent. More pressure, more dissolved oxygen, and it relies entirely on that plasma transport.
And just to be crystal clear, this is fundamentally different from just, say, putting an oxygen mask over a wound. Topical oxygen.
Oh, completely different. A very important distinction to make. Topical oxygen applies maybe slightly higher than normal oxygen pressure directly to the wound surface.
Right.
Studies show it penetrates very poorly, maybe a millimeter or two at most into the tissue. It doesn't systemically increase blood oxygen levels. And sometimes the devices used to apply it can actually impede blood flow out of the area, which could ironically worsen things locally. HBO2 works from the inside out, delivering high oxygen levels via the bloodstream throughout the body. They're not equivalent therapies at all.
Got it. Okay, that covers hyperoxygenation really well.
Yeah.
What about the other primary mechanism you mentioned, the increased pressure itself? What's its main job?
The most direct effect of the pressure is physical.
Hmm.
It shrinks gas bubbles. This is based on Boyle's law. Increase the pressure, the volume of a gas bubble decreases.
Okay.
This is absolutely life-saving in conditions like decompression sickness, the bends, where nitrogen bubbles form in divers,
Right.
and arterial gas embolism, where air bubbles get into the arterial circulation and block blood flow, potentially to the brain or heart. Applying pressure literally squeezes those bubbles smaller, allowing blood flow to resume and giving the gas time to dissolve safely.
Makes immediate sense for bubbles. Does the pressure do anything else relevant to, say, wound healing?
It does play a supporting role. That increased pressure also acts as a physical force, helping to push the highly oxygenated plasma through some of those barriers we talked about, edema fluid, maybe some types of scar tissue. It just makes it easier for oxygen to get where it's needed. And it enhances the washout of other gases by creating a steeper pressure gradient for them to leave the tissues.
So the primary effects give that immediate hit, more oxygen, smaller bubbles. Now let's shift to the secondary mechanisms. These are the ones that build up over time and give the lasting benefits.
Exactly. These secondary effects are generally additive. They require repeated HBO2 treatments to really manifest, but they often lead to more durable, long-lasting physiological changes and are responsible for many of the sustained clinical improvements we see.
Okay, first up is vasoconstriction, narrowing of blood vessels. Now, hang on. Breathing more oxygen makes blood vessels narrow. That sounds backwards for healing.
It does sound counterintuitive, doesn't it? But yes, the high levels of oxygen achieved with HBO2 trigger a generalized, mild narrowing of healthy blood vessels, particularly the small arterioles.
Why?
It's thought to be a natural regulatory response, possibly mediated by the nervous system, to prevent too much oxygen flooding tissues that are already well supplied. But the interesting part is the consequence.
Which is?
This mild vasoconstriction reduces blood flow slightly in healthy vessels, maybe by around 20%. This decreases the pressure inside the capillaries, which in turn reduces the amount of fluid leaking out of those capillaries into the surrounding tissue.
Ah, so it reduces swelling edema.
Precisely. It helps reduce edema. And crucially, even though blood flow might be slightly down, tissue oxygenation is maintained or even increased.
Because
of the huge amount of oxygen dissolved in the plasma. Remember the hyperoxygenation effect. Even with slightly less flow, the blood is carrying so much more oxygen that the net delivery to the tissue is still very high. So you get the benefit of edema reduction without compromising oxygen supply to the cells that need it.
Okay, that makes sense now. Less swelling, but still plenty of oxygen, thanks to the plasma boost.
Yeah.
What about the direct effects on the cells actually doing the healing work?
This is where things get really interesting for tissue repair. We know that key cells, like fibroblasts, the ones that make collagen, the sort of scaffolding for new tissue,
Right.
neutrophils, the infection fighters, and osteoclasts involved in bone remodeling all need adequate oxygen to function properly. They have specific oxygen thresholds.
So take fibroblasts. How does HBO2 help them?
Well, fibroblasts need good oxygen levels to migrate into the wound, to proliferate, multiply, and importantly, to secrete collagen effectively. If oxygen levels are too low, what happens is interesting.
What's that?
Hypoxia actually signals fibroblasts via a factor called TGF-beta1 to lay down a really dense, disorganized, less flexible type of scar tissue, hard scar.
Ah.
By providing sufficient oxygen with HBO2, you encourage the formation of a more organized, pliable, functional scar, a soft scar if you like, better quality repair.
And what about growing new blood vessels?
Yeah.
Angiogenesis. That must be vital for long-term healing.
Absolutely critical. Angiogenesis is also highly oxygen dependent. It relies on fibroblast activity and, crucially, on an oxygen gradient, a difference in oxygen levels across the tissue.
A gradient.
Yeah, a signal that says, hey, we need more oxygen over here. This gradient, along with factors like VEGF, vascular endothelial growth factor, which is also stimulated by adequate oxygen, triggers new capillary growth. Dr. Philip Marks did some key work showing significantly increased blood vessel density in tissues after a course of HBO2 treatments.
And how long does that take to kick in?
Angiogenesis isn't immediate. You typically start seeing evidence of new vessel formation after about 10 to 14 days of regular HBO2 therapy. It's one of those cumulative secondary effects.
Right. And the immune cells, the neutrophils we mentioned earlier, fighting bacteria. How does HBO2 boost them?
Their main weapon against bacteria is that oxidative burst we talked about.
The 100-fold oxygen demand.
Well, maybe not quite that high for the killing part itself, but the process is still highly oxygen dependent. They need those tissue oxygen levels up in that 30–40 mmHg range, at least. Below that, their ability to generate those bacteria-killing reactive oxygen species, peroxides, superoxides, is severely hampered. HBO2 basically refuels their weapon system in low-oxygen wounds.
Makes sense. And bone cells.
Mm-hmm.
Especially thinking about something like chronic bone infection, osteomyelitis.
Yeah, bone metabolism is also oxygen dependent. Osteoblasts, the cells that build new bone, need oxygen. And osteoclasts, the cells that resorb or break down bone, also need it.
So how does that help in infection?
In osteomyelitis, you often have areas of dead infected bone called sequestra. Osteoclasts need to remove this dead material before new, healthy bone can form, but often these infected areas are very hypoxic, low in oxygen.
So the osteoclast can't work well.
Exactly. HBO2 can improve the oxygen levels enough to allow those osteoclasts to get in there and clean up the necrotic bone, which is a really crucial step in resolving the infection and allowing healing.
Okay, we've covered our own cells pretty well. What about the direct impact on the bugs themselves, the bacteria in the wound? Is it just killing them?
The picture there is a bit more nuanced than just direct killing, especially for common bacteria. For aerobic bacteria, the ones that use oxygen, HBO2 doesn't usually harm them directly. But for many anaerobic bacteria, the ones that thrive without oxygen.
Like the gas gangrene ones.
Exactly, like Clostridium species that cause gas gangrene and some anaerobic strep or bacteroid species. For these, the high oxygen environment created by HBO2 can be bacteriostatic, meaning it stops them from growing and multiplying.
So it halts their progress.
Yes, and perhaps even more importantly, for Clostridium particularly, HBO2 is very effective at shutting down their production of dangerous toxins, like the alpha toxin that causes so much tissue destruction in gas gangrene.
So it disarms them even if it doesn't kill them outright.
Precisely. There's also evidence it might directly inactivate certain toxins, like theta toxin from Clostridium, and possibly even the venom of the brown recluse spider, though that's less certain.
Fascinating. And I remember reading it can make some antibiotics work better.
That's another important secondary effect. HBO2 can work synergistically with certain antibiotics, particularly aminoglycosides like gentamicin.
How does that work?
These antibiotics need to be actively transported into the bacterial cell to work. That transport process requires energy, which requires oxygen. In a low-oxygen wound environment, the antibiotic struggles to get inside the bacteria.
So HBO2 provides the oxygen needed for the antibiotic transport system to function.
Exactly. It helps the antibiotic get to its target site within the bacteria, making it much more effective.
What about that damage that sometimes happens when blood flow returns to an oxygen-starved area? Reperfusion injury.
Yes, reperfusion injury. It's a complex problem.
Yeah.
When blood flow is restored after a period of ischemia, or lack of oxygen, it can trigger an inflammatory cascade. Neutrophils become activated, stick to the lining of the small blood vessels,
And release damaging substances.
right, reactive oxygen species and enzymes that cause further tissue damage, paradoxically, just as oxygen is returning. HBO2 seems to help mitigate this.
Now,
One key mechanism appears to be that HBO2 interferes with the process of neutrophils adhering or sticking to the endothelium, the blood vessel lining. If they don't stick, they don't release their damaging contents quite so readily, dampening that inflammatory response.
okay. We also touched on gas washout earlier for CO poisoning. Is that considered a secondary mechanism too?
Well, the initial rapid washout is primary, but the continued enhancement of eliminating unwanted gases happens over the course of treatment, so it has secondary aspects too. The high oxygen gradient created by HBO2 continuously drives out gases like carbon monoxide or the nitrogen involved in decompression sickness. There's also a related, more complex phenomenon called isobaric counterdiffusion.
Isobaric counterdiffusion.
Yeah, it involves switching the gas mixture the patient breathes while still under pressure. It can create specific gradients to accelerate the removal of certain inert gases, particularly relevant in treating decompression sickness. It's a bit technical, but another tool in the toolbox.
And it sounds like there are even other potential mechanisms still being explored.
That's right, research is ongoing. One interesting area is red blood cell deformability.
How flexible the cells are.
Exactly. In conditions like sepsis or severe hypoxia, red blood cells can become stiff, making it harder for them to squeeze through those tiny capillaries to deliver oxygen. Some studies, particularly by Tom and others, suggest HbO2 might help restore that flexibility, improving microcirculatory flow.
Interesting. Anything else?
Another area is the blood-brain barrier, the protective layer around the brain. There's evidence HbO2 can temporarily increase its permeability.
Make it leakier. Why is that good?
Well, potentially it could allow better delivery of certain drugs into the central nervous system, or maybe improve oxygen access to brain tissue in specific situations. It's still an area of active investigation.
Wow. Okay, that is an incredible array of effects, from physics to cell biology to microbiology. So if we try and bring it all together, what's the main takeaway message from this deep dive?
I think the key thing to grasp is that HbO2 isn't just giving oxygen, it's a complex therapy. It uses hyperoxygenation and pressurization as its immediate primary tools, yes. But these trigger a whole host of secondary downstream effects that impact vasoconstriction, edema, fibroblast function, angiogenesis, immune cell killing power, bone turnover, bacterial toxin production, antibiotic effectiveness, reperfusion injury. It's truly multifaceted.
So while those primary effects are crucial for the immediate situation, it's the buildup of these secondary mechanisms over a course of treatment that leads to the really significant lasting healing improvements we often see.
Exactly that. The hyperoxygenation provides the immediate fuel, and the pressure handles things like bubbles. But it's the cumulative effect of optimizing the cellular environment, boosting the body's own repair processes, and hindering the pathogens. Those are the things that lead to the durable results that can sometimes seem quite remarkable.
This has been incredibly insightful. Thank you. Considering all these different ways HbO2 interacts with our biology, it really does make you wonder, what else could it be doing? What other conditions might benefit? Could it perhaps influence things like stem cell activity or offer neuroprotection in ways we haven't fully explored yet? Definitely food for thought. Thanks again for joining me on this deep dive.